Hey everyone, my name is Catherine. I'm going to be comparing the response to COVID-19 in Germany and the United States. And I chose to compare Germany's response to the US because their actions have been exemplary, and I thought the information would be easily accessible on Germany's response. So first, let's set the foundation by looking at the demographics of both countries. We can see from this table that the United States has a higher urban population than Germany at 83%, and Germany's at around 77%. And the US has almost 4 times the population of Germany at 328 million people in the US and 83 million people in Germany. And I've also put the death and cases totals here for us to look at the difference. And on the next slide, I have a graph that's a better visual representation of these differences. I also want to mention a couple of other statistics that are important to keep in mind as we're comparing the responses of the two countries. First, the physicians density in Germany is much higher. Germany has 4.21 physicians per 1,000 people, whereas the United States has 2.59 physicians per 1,000 people. Also, Germany's hospital system had a solid foundation prior to the pandemic, although they spend much less in health expenditures at 11.2% than the US at 16.8%. Germany has 8.3 hospital beds per 1,000 people, and in the US there's 2.9 beds per 1,000 people. Also, another statistic I want to mention is the obesity rate in both countries. Germany is at 22.3% and the US at 36.2%. So in general, people in Germany take better care of themselves, which could have played an important role in their speedy recovery from the SARS-CoV-2 virus. These graphs show the cases and death rates from COVID-19 by country. In both graphs, we can see the US had more cases and deaths than Germany, even adjusted for population. In the website, I got the graph on the left is a really neat tool because it's interactive and lets you choose which countries you want to compare. And looking at the graph on the left, as of May 24th, the US had around 97,000 deaths, 0.3% of the population, and Germany had 8,200 deaths, which is 0.01% of their population. And the graph on the right shows the number of cases as of May 20th. The US had about 1.5 million cases, and Germany had about 180,000 cases. Okay, so Germany was very prompt in their response, as we can see from their timeline. They took less than 1 month after the first COVID-19 case in Germany was confirmed and began their campaign in early January. Germany took a scientific database approach when responding to the virus. Germany's government introduced strict social distancing measures on public gatherings and washing hands. And there was a nationwide ban on public meetings of more than 2 people outside of the workplace for 2 weeks. German companies even made the decision to stop production because many markets aren't accessible right now, not because of political decisions. And hospitals were asked to postpone elective operations to free up beds. And within 10 days, there were 10,000 empty beds for COVID patients. The country placed an early emphasis on testing capacity, isolating and tracking cases, and Germany was actually the first to develop the diagnostic test for COVID-19 in January. And as we can see, by the beginning of April, the number of cases were down and Germany started to lift their coronavirus measures. And Germany has still been able to flatten the curve because of the high capacity of testing. Even as cases have surged, their death toll has remained really low. Okay. And next, we're going to look at the timeline of the US response to the virus. In the US, the Trump administration took time to initiate the response. In mid-March to early April, 2 months after the first known case of COVID in the US, um, were the shelter-in-place orders issued. So after 2 months is when we issued those responses. And it wasn't until April 3rd that Trump urged Americans to wear face coverings, and the US enacted non-pharmaceutical measures such as stay-at-home orders and social distancing. We also implemented clinical protocols to prevent the spread of infectious diseases, including proper hand hygiene and sanitation procedures. And many states in the US issued shelter-in-place or stay-at-home guidelines. These orders were put in place to help prevent those avoidable hospitalizations so that beds could be available to treat those COVID-19 patients. And it also helped alleviate the burden of our healthcare system and minimize some of those exposure risks. Next, let's look at the healthcare response in both countries. Germany took a high-risk approach to the virus. The oversupply of hospital beds has helped Germany fight the virus, and Germany even implemented what they call a corona taxi, which is basically just house calls where they will, test the public through house calls. Germany has tested twice as many people per capita as the US at 500,000 people per week, which means fewer infections are being missed. In Germany, any doctor can perform a coronavirus test, and public health insurance will pay for it. They have been resilient because of the big testing capacity and strong health system, and they have continued to conduct extensive testing to find those mild and asymptomatic cases as well. And there's been a broad network of labs in Germany that have been utilized during the pandemic, and Germany has heavily invested in the healthcare system for years prior to this pandemic, so they were already set in a good position when the pandemic started. They also have a good network of general practitioners that take care of those soft cases to avoid overrun of hospitals so that the hospitals can take care of the more severe cases. And Germany's strong healthcare system has some of the highest numbers of ICU beds and ventilators in the world. So Germany took care of some of those soft cases and the virus and tried to follow up with patients that were showing symptoms. And despite having some of the highest cases in the world, Germany's hospitals are still not being overrun or overwhelmed. The US had 67.9 hospitalizations per 100,000, with the highest rates in people aged 65 and older. The US was understaffed and under-resourced for this pandemic. And the US healthcare system took measures based on the guidelines from the CDC, from WHO, and CMS, which is the Centers for Medicare and Medicaid Services, and other institutions. So the US expanded their virtual telehealth programs to continue patient care without unnecessary exposure risk. And despite being overwhelmed, hospitals and suffering medical staff to patient ratios, the US healthcare still attempted to provide high quality care while helping to minimize the exposure to the infectious disease. Okay, so next we're going to look at the public health response to the virus. Germany implemented a three-part formula to curb the virus, which was honesty, testing, and isolating the sick. And Germany didn't panic or fear the infection like the United States did. Germany's Minister of Health, John Spahn, said their goal was to find a balance between the lockdown, liberty, and preserving economic loss. They took it very serious from the beginning, which gave them an advantage and gave them time to prepare. Germans followed rules because there was a really broad support for these actions, and they understood that it was their civic duty to protect others. They even helped other countries take in patients during this time, such as France, Spain, and Italy, and they brought them into their own hospitals. And the US struggled to find the right balance in their response. Local and national public health authorities ensured that the public had the most up-to-date information to manage the spread of the virus. And public health officials audited PPE at care centers and worked with suppliers to minimize supply chain interruptions. The public health system educated the public on symptoms that could indicate a need for medical care. And the US took a political stance when responding to the virus. Facts were often misrepresented by the nation's leader and other government officials. And the US was unable to effectively respond to this challenge on a government level. And Trump downplayed the virus and he actually said it's like the regular flu, which was not true. But overall, the US public health system faced many challenges and had to adapt pretty quickly to some of these ongoing information that they were receiving. The US collaborated with other health fields, but they were slow to share the evidence and reliable information to the public. And to wrap up, let's look at the impacts of vulnerable populations and the equity of some of the responses. So we're not comparing apples to apples when we're looking at these different countries, because different countries are counting the death rates differently and testing differently. So the high rates of unemployment from recession has been harmful for mental health and physical health of people. And in Germany in particular, younger and healthier people were infected more than other countries, which was kind of unusual because in the United States, the elderly population was more impacted by this virus. So the CDC identifies people who are at higher risk of infection as 65 and older, in a long-term facility, immunosuppressed, and people with underlying illnesses. The US took additional measures to protect the senior population, as designated shopping hours at stores like Walmart or grocery stores, Lowe's, those kind of things. And members of racial and ethnic minorities living in these densely populated areas are at more risk for contracting the coronavirus because they're in such close proximity. Low-income populations were disproportionately affected because many of their jobs were non-essential and many people lost jobs. People living in multi-generational households, which is more common in ethnic minority families, have to take extra precautions to protect older family members. And then also, congregate living in jails and prisons puts people at higher risk of contracting the virus. People with lower access to care and existing health disparities face barriers to getting health care because of the stigmas and health inequalities, such as the homeless population. Boris Palmer, which is a German mayor, said, "In Germany, we are possibly saving people who will die in half a year anyways because of their age and previous illnesses." And German leadership focused on subgroups of society as potential casualties of this virus. Some people received that message as the disease affects only the elderly and the vulnerable populations. So self-restraint was seen as an act of altruism rather than self-interest. However, a significant proportion of people did not see the virus as an urgent threat in Germany. In the US, racism and stigmatization have increased, particularly towards the Asian population and American Asian population. So there was a lack of accessibility to testing kits in low resource communities. Also, computers and internet are not distributed equally. And some people did not have access to online learning platforms and announcements. So, they could have a slow internet, or students that were attending school online may have been inhibited. So, like I was saying, some students suffered from distance learning as they didn't have the resources to continue their education. Also, social determinants of health played an important role and really took center stage during the coronavirus crisis, particularly working conditions, the physical environment, education, social support networks, and income and social status. Social determinants of health helped public officials tailor their programs to address the needs of target populations. And I think the overall goal for both these countries and every country is to further adhere to the hygiene and the measures that are in place to keep the distance in our daily lives, but ultimately to get the economy back on its feet. So that's all I have. Thank you very much for watching my presentation, and I hope you learned something. And here are my references.